Welcome to our Mary Greeley Primetime Alive presentation, Your Healthcare, Your Say, Exploring Advanced Directives. I'm Vicki Newell with the Mary Greeley Primetime Alive program. As a reminder, if you'd like more information about Primetime Alive or to sign up for a program, you can go to mgmc.org/PTA. Our presenters today are LeighAnn Gibbs and Jody Calvert. LeighAnn has been an RN for 34 years after she earned her RN degree from DMAC. She worked for Palo Alto County Hospital for a year. She then worked in cardiac pediatric home care for 4 years. Her last 30 years of her nursing career has been in hospice. Her passion for nursing over the years included caring for patients from the beginning of life until the end of life. And this is LeighAnn. And then Jody. Jody has a bachelor's degree in social work from the University of Northern Iowa and a master's degree in social work from the University of Iowa. She spent 10 years working for youth and shelter services in Ames before working over 20 years at Mary Greeley as a medical social worker. Jody transferred to Mary Greeley Hospice Home Care 2 years ago. Please welcome LeighAnn and Jody. Okay. Can you guys hear me okay?
I thought it was on. Yeah, it's on if I talk like that. Okay, I'm just going to do this. Anyway, my name is LeighAnn. I'm a nurse. I work with Mary Greeley Hospice. And today, and I think this might be the part where you say what she always wants to say, we talk about advanced directives, and Jody's thought here.
I always say that in our world of making people do things anymore, I can't believe that our world doesn't make people have a medical power of attorney. And after working at the hospital for 20 years as a social worker, being on call, going to the ER middle of the night, middle of the day, whenever I would be called there, you know, you have people that have something happen unexpectedly, whether it's a stroke or a car accident or whatever it might be. If you're in a position that you're not able to make medical decisions for yourself temporarily or permanently, it is such a great idea to assign someone to that job for you. And whoever you assign to that job, you want it to be someone that is going to carry out your wishes, not what they think would be best for you, but what you would want for yourself. I also have a friend that's my age, and her sister is her medical power of attorney, not her husband, because she says her husband would keep her alive no matter what condition she was in. And that's not what she wants. And so she chose someone that she believed would carry out the wishes that she would want. And I also have had this conversation so many times over the years as I've done these advanced directives with people in the hospital and people out of the hospital, is I will say to them, you know, what are your wishes? You know, what kind of care do you want? What kind of care do you not want? Because it's important that you share with the person that you have selected to be your medical power of attorney to know what your wishes are. And surprisingly, many would say, well, we've never talked about this. And I'll say, well, has your wife or has your husband ever said, gosh, if my quality of life is like so-and-so, who happens to not be well at the time, you know, I would want you to make sure that I'm comfortable, you know, and not continue treatment or whatever it might be. And so many will say, no, my husband's never said that. My wife's never said that. My brother's never said that, whatever the situation is. So as much as those are conversations that aren't really in the fun category, it is good to talk about what you want and what you don't want. Because especially when you come into the emergency room, their job is to treat you. And their job is to do everything that they can to keep you alive. And so they're going to treat and they're going to order testing and they're going to do all these things that they can for you until you say, I don't know that we want to go that far. I don't know that we want to go to the cath lab. I don't know that we want to have an MRI or whatever the situation is. It's important to know what you would want to do before you're in that situation, because it's harder when you're in that situation because your mind might not be thinking as clearly. And, you know, things that we've thought through beforehand, usually it turns out to be it's a good idea to think about it beforehand. So we're going to talk all about what advanced directives are. we'll give you copies and we'll answer questions that you have.
Okay, so advanced directives, people hear that word and it's kind of an umbrella word. It can mean different things. So advanced directives, as the first bullet says, are legal documents that state your healthcare wishes. It can be very specific about what you want and what you don't want. Another advanced directive or part of advanced directives can be appointing, like Jody says, appointing somebody who's going to make the decisions that you want them to make. And I agree, I would have Jody probably make my decisions, not my husband. And there are, some of the specific things that it can cover are such things as end-of-life choices, feeding tubes. Sometimes I feel when I am talking to people in the hospital about this, maybe an easier question is, what do you not want? Sometimes it's hard to think about what do you want? Because sometimes some of us don't even know what's out there to be offered, but we know what we don't want. This slide here talks about DNR, which is an acronym for do not resuscitate. So that's going to be in a full code, that first point. They're going to do anything and everything to save your life, including chest compressions, putting a tube in your airway to breathe, maybe putting you on a ventilator. So it's everything. And many times that's very, very appropriate. Sometimes it's not. Partial code. Partial code is kind of a sticky situation because it says allowing selective interventions tailored to patient preferences, balancing care and comfort. Sometimes in the heat of that moment, that can be left up to interpretation, and that can be tough. And then there are people who are no code. They don't want CPR. They don't want the breathing tube. They don't want any of those kind of things. When people do make these decisions, it is very important that they talk to, of course, the people that maybe are going to be their appointed person, talking to their physicians, that kind of thing, having a copy of this at the hospital in the medical records. So maybe you want to talk about this. Jody did a lot of this at the hospital.
So an advanced directive can have two parts. You can do both parts, or you can just do one part or the other part. The one part is what LeighAnn and I spoke of, a medical power of attorney, appointing someone to make medical decisions for you temporarily or permanently, depending on the situation. And of course, at the hospital, we would have people that temporarily could not make decisions for themselves. When they're in a position again that they can make decisions for themselves, they have that privilege again. The second part of an advanced directive is a living will. And it outlines medical treatment preferences when you cannot communicate, and it's focusing on life-sustaining measures. So if you read a living will, it states that if I have an incurable or irreversible condition, then I am choosing to not have any intervention. But if it's believed that my life could improve and I could be okay, then I want intervention. So discussing, if you want a living will, discussing that with your family and doctors ensures clarity, and it reduces emotional stress during critical moments. Store this document accessibly, share with your healthcare proxy, and review regularly after major life events. In our world now of electronic medical records, if you create an advanced directive naming a medical power of attorney and saying you want a living will, it's all in one document. You can either have it signed by two unrelated, uninvolved people or a notary. Once that is done, it's important that you give it to your doctor, that you give it to the hospital. Here in Ames, if you give it to your doctor at McFarland, it's going to go in our electronic medical record and we can see it at the hospital. And we can see lots of things from other hospitals too now. Not every hospital in Des Moines and not every document at every hospital, but we have access to a lot of things across the board now. everywhere all the time kind of thing. But if you doctor here in Ames and you get care at Mary Greeley, we can easily see each other's stuff, but we need a copy of it to be able to view it. And if you ever choose to change it someday, the most current dated one is the one that's valid. And we don't get rid of the old one in your medical record, but we put the new one in and we can see that that is the one that is of the most recent date. So again, we've already touched on this, declaring durable medical power of attorney. Choose a trusted agent to make healthcare decisions when you're incapacitated, providing flexibility beyond a living will. So a living will says that, like I said before, that if your condition is not reversible or curable, then you don't want big interventions. So in addition to that, who actually makes those decisions for you? That's your medical power of attorney.
And that is only in effect when you cannot make decisions for yourself. So you can't say, I don't like your decision and I'm your medical power of attorney, because we do hear that. This is only in effect when you are unable to make decisions.
Or sometimes we'll have patients that are completely capable of making their own decisions, but they'll say, I don't want to do that. I want my son to decide. And that's fine, but if you're capable of making decisions for yourself, then we need to hear it from you. And always, I mean, family can make decisions together. That's no problem at all, and many do. So choose an agent who understands your values, communicates well, and can handle stressful medical situations effectively. When you're creating the durable medical power of attorney, when you're creating your advance directive, it needs to be notarized or witnessed, and then it remains valid until it's revoked. Appointing a medical power of attorney prevents family conflicts and guarantees your healthcare aligns with your personal values and wishes. It's a great idea to also let the person know if you have chosen for them to be your medical power of attorney. You don't have to, but it's a good idea to do that. And if you're afraid that it's going to make, if you choose your son and you're afraid your daughter and your other son might be upset, share with them, maybe it's because one is closer. Maybe it's because one has more medical experience. Maybe it's better because one is better under pressure kind of thing. But just share with your family that we've chosen Sally because we feel like she would be our best advocate. Sorry if that upsets any of you, but this is the decision that we've made kind of thing. If you do not have an advance directive, the state of Iowa has an order in which we need to follow, and I'll share that a little bit later as to how we do that if you don't have one in place.
Okay, so IPOST, this stands for Iowa Physician Orders for Scope of Treatment. I can't just rattle that off. I have to read it. So I call it an IPOST. And an IPOST is a salmon colored piece of paper to begin with. So it's a medical order that clearly communicates patient treatment preferences to all healthcare providers. So we provide assistance with creating an IPOST at the hospital. They do it at the clinic. I know they can help do that in long-term care facilities, but it does require the signature of a physician. Unlike advance directives, IPOSTs are an actionable document that healthcare professionals must follow in emergencies. So here would be an example. Maybe I see a patient in the hospital that's going to go home, but they do maybe have a condition and they don't want to have aggressive treatment. The IPOST looks at certain situations, nutrition, whether or not you want artificial nutrition or not. Do you want comfort cares? Do you want aggressive care? This is an order that we get signed by the physician. And again, it's on this salmon colored piece of paper, and people take that home and it's an actual doctor's order. the easiest way that I found to explain it is if I'm in the hospital, I can get right in the chart and look and see what you want. But when you're at home, there is no chart. So here's this salmon piece of paper. And I tell people, when you have that, put it on your refrigerator. The paramedics here in town, the paramedics all over Iowa know when they go into a home, they look at the refrigerator for a salmon colored piece of paper, which says how much care you want. And I have examples of all of these documents that we're talking about today, if anybody's interested in that. So as I was stating earlier, it talks about resuscitation, hospitalization, artificial nutrition, and comfort care, varying degrees of that. So they should keep this accessible and review it regularly. Sometimes, for instance, a patient will put, I want limited care. And then as time goes on, maybe they're diagnosed with a condition that's very terminal. They'll go back and redo the I-post and say, if I need something, I just want comfort care. We see the I-posts a lot when people come back into the hospital. The ladies pull them out of their purse and then they put it up on the wall on the head of their bed at the hospital. So when they're traveling out and about, this order is valid. So I can't remember what year that started.
I would guess 12 years ago, something like
Than
that.
that.
More?
Than that.
Yes, ma'am.
So I'm wondering, because I know we've had programs before on this.
Uh-huh.
Should everybody have an I-post or is there a certain?
That's I'm glad you said that because I neglected that part. This would be for somebody with a critical, chronic, healthcare condition or terminal condition. I wouldn't have an I-post. Yeah. Does that make sense?
If you have the durable power, medical care in the living will, do you need the I-post?
The I-post is,
Just repeat so people at home hear the
Yes.
question.
she wondered if somebody has the living will, do they need the I-post? Right. And the medical power of attorney.
Mhm.
The I-post is more specific. It states your wishes. It's not super specific, but I think I went the wrong way there. Anyway, like, do you want comfort cares? Do you want artificial nutrition? So the living will doesn't state that. Yeah. Yes.
My husband was in hospice care and I became friends with a nurse. And she said, do not put it on the refrigerator because the ambulance, when they come, will not hunt in your house to see where your fridge is. She said, put it on a light colored document right by the entrance of your house.
That's a good place to where to place the I-post in your home. So probably the moral of that is put it somewhere where the paramedics would see it when they come in your home.
That's the first time I've ever heard that. In the trainings that I've gone to, they've always said it's always a salmon colored piece of paper and it always goes on your refrigerator because that's where, sorry, so I'm not trying to contradict what you're saying, but that's the first time I've ever heard that. I've always just heard put it on your refrigerator because that's where the paramedics are trained to look. And then it needs to follow you. So if you're going to the hospital and the paramedics are taking you to the hospital, they're going to take that with you. You get one. I say it's kind of like a passport. You get one. You don't make copies of it and put one in your billfold and one in your purse and give one to each kid. You're supposed to have one. And that allows medical professionals to clearly know immediately what your wishes are. They don't have to flip through a chart. They've got that piece of paper that says, I want to have a do not resuscitate order. It's the only way you can truly have a do not resuscitate order at home. Because if you call 911, you're saying, I want you to come and treat me. But that doesn't mean you have to do CPR. That doesn't mean you have to do all these aggressive interventions. So if that I-post is on your refrigerator that says, I have a do not resuscitate order, The paramedics are not going to do CPR if you code in the ambulance on the way to the hospital. But that might be just fine with you. I mean, maybe you've got a chronic condition, maybe you've got a terminal condition, maybe you're whatever age you feel like is old enough that you don't want to live anymore kind of thing. So, it just makes it clear to the medical professionals what you want and what you don't want.
If they don't know what you want, they will give you CPR.
Can we hold off on other questions is it something to clarify right now what she's talking about? Okay.
Copies are valid. And you should have a copy in your billfold because something could happen to you out on a road. Then you have to have it with you so the ambulance there knows you do not want to be resuscitated, for instance.
She's stating that the copies are valid just so that if you do get into trouble, you've got it. And I have seen copies. Yeah. It's a physician's order with a physician's signature, and in the legal world, you're not supposed to make copies of that, but we see them. We see them. People bring them in. Yep. I'm hoping I didn't miss a slide here, Vicki.
No, just
Okay.
down arrow.
Okay.
In the way it was set.
Okay. All right. 5 wishes document. Does anybody know what the 5 wishes is? Has anybody done that? It's really a cool, it's really just a cool little deal. We actually have a nurse in the hospital that is certified in 5 wishes. It's just a really neat thing. So there's 5 areas, hence 5 wishes, that's covered, and it talks about decision-making, treatment choices, comfort, personal treatment, and messages for loved ones. It gets really as personal as you want it to be. Legal validity and ease. This is what I think is so neat. 5 wishes is legally valid and easy to complete without an attorney, encouraging peace of mind and clarity. It promotes open dialogue with loved ones and healthcare providers, reducing uncertainty and conflict. I shouldn't have done that yet. So that 5 wishes is legal, just like a living will, a durable medical power of attorney. It can be notarized or witnessed, and it's a legal document. So I brought quite a few 5 wishes books if people are interested in looking at those. And I think that it provides a lot of good opportunity, whether you complete 5 wishes or not, just a lot of good dialogue. And then when people do end up in the hospital, I always find myself asking, did you and your husband ever talk about what you would want to do in an event like this? Even if there's nothing legal on a piece of paper, there's such a peace of mind of a wife being able to say, I know this is what he would want because this is what we talked about. And that's what I think 5 wishes really does well, whether you utilize it in a legal way or not. So this form here, declaration of designee for final disposition. I wanted to talk about this because I think sometimes this is just kind of a surprise. So this specifies who decides final body disposition to ensure your wishes are respected and prevent. It's always talking about family disputes. So this is after you die, who's going, if you haven't got everything all set in stone and paid for and in the safe somewhere, it's going to default in that same order that Jody spoke of earlier. In the state of Iowa, if people do not have legal documents stating who they want, to make decisions for them, the state of Iowa will start at the top. Your spouse, don't have a spouse. Your parents, don't have parents. Your children, so there's an order, and it's the same with the final disposition of your body. If you do not have that legally stated somewhere.
So in the state of Iowa, the order is your spouse has the privilege of making medical decisions for you, as well as decisions on final disposition.
Mhm.
If you do not have a spouse, then your children. I know from medical power of attorney, your children collectively make a decision. I'm not certain on the final disposition part, if they go oldest to youngest child, or if it's
Mhm.
the kids make the decision
Majority.
together, majority decision. So spouse, children, parents, siblings is the order that it goes in the state of Iowa of who would make medical decisions for you if you don't have a legal document in place. This designating someone for final disposition, working for hospice, we encounter this fairly often, really, that maybe, we have people that don't have family. We have people that don't have homes. So we have people that if you have not designated someone, we're kind of really in a pickle. So it never hurts to have more documents than you think you might ever need. And this ensures that your wishes are followed through, that are done.
So that, does that apply also if they're not mentally able to make decisions?
She asked if that applied if the person was not able to make decisions. So it's going to default this way. So let's say, for instance, the person to make decisions for you is your spouse or maybe your kids. How about this? This is a good example. Your kids. You haven't seen them for 30 years, unfortunately, but they are the ones that are going to make this decision for you because you haven't made any legal provisions otherwise. If you do make legal provisions here with a designee, that person would supersede the children. Yeah.
I think she's saying, like, if I picked my spouse and then down the road I didn't change it, my spouse had a stroke or dementia or something,
Okay.
and it went to him,
Okay.
then they do.
That's,
Child has a special need, and that's what.
Yeah.
To.
yeah.
What happened with my mother, like you said, I hadn't seen her in probably 20 years. And she was never mentally stable. So when she was making decisions, she wouldn't point anybody as a power of attorney or anything like that. And so when she became more senile, and then everybody kept asking me, because I was the only daughter, it's like, did she appoint anybody? And it's like, no, she refused to. So then the state of New York was like, okay, you have to do this because you're his daughter.
Correct. It is. Yep. Yep. The decisions, if there's not legal provisions in place, the decisions for healthcare, body disposition, all of that default
She
to that.
ended up in the nursing home, and they called me to convince her to sign papers. And after talking to her on the phone for half an hour, I got on the phone with the guy again, and I said, you're gonna have to send them in without her signature, because I can't.
Can we get back and finish the presentation? And then if there's some specific stuff like that, but I want to make sure the people who are here are getting the information you want,
Right.
and then we'll go on to questions.
Will do.
All right. Thank you.
And again, the benefits of this, family all gets along. So yeah, that's our last slide. And like I said earlier, I did bring all of these documents, and we have a palliative program in in the hospital. And that's a lot of what they're doing with people, are talking about these things. And so every hospital that I know of now asks people when they come in, do you have a need for this? And I'm loving to hear that. Because again, it's of all the things that we have to decide, I can't believe that this isn't, at least a little bit of direction. So I think that hospitals are doing a better job. So of asking when somebody's admitted, even through the ED, the emergency department, they'll say, hey, are you interested in learning about advanced directives? Because they ask you when you come in, do you have anybody to make decisions for you if you can't? No. Well, how about this? And so we have people that do that.
So you're talking if you're a patient?
Yes.
Is it something?
Yes. And you know what else? So if you are a patient, I've done this before. I go and do advanced directives with people. So I'll get a referral that'll say, hey, somebody, Mary wants to talk about advanced directives. She's in room 3. So I go there, I take my documents with me in case she wants to do them. And she says, oh, yes. So we fill them out, and her husband's sitting there and he says, you know what? I don't have any done either. Can I do that too? And we do that too. And so then my next job is to get a hold. We have notaries in the hospital. And I think that it is just, and it's the same with all the other hospitals, that why not? Then you don't have to go to the bank to do a notary. You don't have to go to your attorney. You can have 2 non-related people witness that document too, but sometimes that's a hassle. If you're in the hospital, you might as well do something kind of, yeah, and it's free. Yeah, it's free. It just is. And I always have this feeling of kind of, you just with your hands, and you're like, ooh, I don't have to worry about that now. But if something changes in your life, you need to remember that you'll want to update that. Like if I was doing my advanced directive today, I would say, yes, I want CPR. If I'm doing my advanced directive and I'm 94 years old and I have a really big lung mass, me personally, I don't want CPR. So I would make sure to try to remember to change that. So.
And so then I have another quick question. You said if you're in the hospital, you're a patient, there's help. If somebody's at home and has questions and needs help,
Yeah.
what resources do they have?
Yeah. I know, speaking for us, I know what resources we have. So we work for Hospice and Mary Greeley Home Health, and we have notaries on our staff that, we've got patients even that are homebound, can't get out, and we can do those documents in the home and come to them. We have copies of all of these documents. We have notaries. Sometimes we've even used the notaries at the hospital to come out to the home. We've just got a really good community for that.
They're not a patient.
But
If they're not a patient, I mean, we have these documents here. You can take them home with you. You can read it through. You can fill in the blank of whatever you want. You can take it to your bank and get it notarized. But then bring it to your next doctor's appointment or drop it by McFarland or wherever you doctor. So they've got it in the electronic medical record. Because if you make one, that's great, but we really need it when you're at the hospital or when you're at the clinic. Yesterday, I was up seeing a lady in Story City and she wanted to do one. And I thought, oh, okay, how are we going to get this notarized? Well, she knows the people at her bank well. We called the lady at the bank and she's like, oh, I'll just come by her apartment today and we'll get it all notarized. I said, okay, then I'll come back and make copies. Oh, no, you don't need to do that. I'll take it back to the bank and make copies and then I'll bring them back to her. Okay, great. So that's Story City. But yeah, wherever you can find a notary, or 2 unrelated people that their name's not on this document in any way, you can have 2 witnesses and it's just as valid. But you really do need to give whoever you have assigned or want to be your medical power of attorney, they need to know this, and it's always a good idea for them to have a copy too. So if you have 3 kids and you're appointing one as your medical power of attorney, give them all a copy so they all just have one.
A lot of documents.
A lot of documents. And I'm just wondering, what is the minimum thing that you think a person should have? Is it just medical power of attorney, a living will? I mean, without all these extra things like 5 wishes and all that stuff. I mean, what is the minimum thing that you would say?
Well, I would say an advance directive that has both a living will and a medical power of attorney. And I say that believing that you would want both of those things. If you don't want a living will, then of course you don't want the document that has that on it as well. But I guess I'll backtrack just a tiny bit. Having a medical power of attorney, as medical people, we feel is critical. But if the hospital or wherever you are doesn't know who your medical power of attorney is, then we're still in the same situation. So that's why we need that document with the medical professionals of likely wherever you're going to be. And really, if you're going to travel, throw that medical power of attorney in your purse. If you're going to Texas or you're going overseas or wherever you are, and then you've got it on your person, because then you're covered.
I was going back to that salmon colored paper.
Yeah.
Now you said if you had one on the fridge, right? What if, and that's notarized, gotta be notarized, correct?
The I-post, the salmon colored piece of paper is signed by your physician.
Okay.
That's what makes it a medical order. And that it's supposed to be an original signature is what it's supposed to be. That's why you're only supposed to have one. But that's the I-post.
Okay, so you can't make copies, you said, right? Can you, like, let's say you're gonna, like you said, travel, can you get another one notarized? Can you have 2 of them notarized or no?
They're not notarized, right?
You can take the I-post with you if you're traveling.
Okay,
So you don't need another one. So yeah, if you're traveling, throw that in your purse.
I think what they're saying is somebody said, I make copies and we've used that. And what they're saying is, yes, we have seen that. However, it's not supposed to be legal, a Xerox copy of a physician's signature. It's supposed to be the original physician, that original document. So you don't need extra copies. You just need to take that original one with you. And then my guess is if you lose it, you just have to fill out another one and have the physician sign it. Does that make sense? Does that answer?
The thing that I think about, you heard me say earlier, we live in a really good place. And a lot of places in Iowa, everybody knows everybody. And, oh, that's a copy that Martha's got. But Martha's son and I went to school together. So that's why we take the copy. That's why I hear that. And then there's other places that just aren't going to be tolerant of that. Because legally, you shouldn't make a copy of a doctor's signature. Yeah. This is Iowa specific.
Oh.
It's an Iowa physician order. Yes, yes,
So it's not legal outside the
No.
state?
no,
Oh, so don't take it with you if you travel outside the state.
it's not supposed to be.
Okay,
It's
But at
Iowa
least it-
specific. Yeah.
okay, okay.
And other states also have their form of a traveling document.
I know this is sounding like it's getting a little complicated. I mean, you're not going to do an I-post type document for every state you're going to travel through between here in Texas or here in Florida. So having this document versus nothing is better. So if you're an Iowa resident and you winter in Florida or you winter in Texas and you need to go to the hospital, you're going to say, hey, I have an I-post in Iowa. These are my wishes. That's better than nothing. So what they want to honor, if you're alone, this is all they've got. If they can, if you can't make decisions for yourself and they need to contact your medical power of attorney, they can say, hey, your mom's got this I-post in her purse that she filled out in Iowa. This shows what her wishes are. It's not technically legal in Florida, but it's made it clear what her wishes are. And that sure is a much better guide for the physician than nothing.
Okay,
Does that help
makes
a
it a little
little?
bit more clear.
Question with, traveling and that sort of thing, and with this age of the patient portal and everything. If we were in another state, can our medical power of attorney, those things be accessed electronically? You guys know?
Yes, yes.
I think so.
9 times out of 10, I'd say yes, and it's because we have an electronic system that we all pretty much subscribe to now. Beautiful. I was in Wyoming a couple years ago, and my husband had a horrible sickness, and we ended up in Cheyenne through the night, and I could have just cried when they pulled up all of his stuff. And I mean, this is, yes. And this is what we all of us medical people chart on every single day. And sometimes we cuss it, but not me anymore. Yeah,
That's what I've relied on, and I just wondered, I
it's
don't take all that stuff.
it's wonderful. Yeah.
And you're talking the patient portal, the My Chart, so you
Mhm.
have that information and you can access it anywhere. We're also talking about, because of our electronic medical record,
Right.
Yes.
that hospital doesn't need your phone to sign into your My
Right.
Chart. They
Right.
can
No.
access it because
That's
you're part of that bigger medical
Bigger
record
system.
system.
Yeah.
Yeah.
Yep. Yep.
But you could give them your information.
But you could give them your information because you would have it, past surgeries and allergies and.
So when we get into the medical record of a patient, we have the privilege of looking into their medical record because we have a purpose of doing that. If we need to access something from the past or from another facility, we go into a section of the electronic medical record called Chart Review. And there's a bunch of tabs there that we can then click on where we can retrieve documents from outside places, other medical clinics, other hospitals that you have been at. Now, we can't read every single note, every single time, every single lab when you were there, but it certainly gives us an understanding of what happened when you were in the hospital in Des Moines 6 months ago, or last winter when you were in Texas and had an ER visit. I'm sure there are still some smaller facilities, some smaller hospitals that don't have that as readily available as we do. So, we can't say 100% of the time they're always going to be able to dig in there and see everything about you. But anywhere of decent size should have access to that now. I know there's a clinic in town here that they're not electronic at all. So if you go to that clinic, your records are all on paper yet. And I'm sure there's other communities that have that too.
So I've got a question about the DNR. When my mom was in the hospital, I kept getting questioned about that. Oh, I see she has a DNR. Are you sure? And it felt really threatening, like I was making a bad decision. Is that typical to get questioned about your choices?
I would like to think not. I think that's unfortunate.
I feel like they ask you that every time
Mhm.
you go to the doctor, whether you have it or not.
Right. And she feels like she gets asked that every time she has an encounter. Yeah. I will tell you, when I have a referral on a patient, and I am taking my notes and they're very clearly laying in the hospital bed with a neck or a bracelet on that says, do not resuscitate. I still ask them. I say, as I understand it, you don't want CPR. I think the way you ask it could, the inflection could be an issue, but I ask that because I think that would be a horrible mistake to make. And I have had patients that had been resuscitated and didn't want to be, and subsequently were my hospice patient. So, yeah, but maybe I would ask them, if I were the daughter, maybe I would ask them, do you have some concern about that? Yep. Yeah.
I have a question. What if there's a conflict between documents? Let's say one document says DNR and another one says a partial, and they're both dated the same. Which takes precedence?
I thought I had an answer till you started talking about the date.
Why would that happen if it's the same day?
Yes.
I mean, I'm just,
Scenario.
Has that happened and you're aware of that? Oh, okay.
I can see if it would happen a different day. Maybe you changed your mind and you don't,
Yeah.
maybe on Monday, you said, I want a do not resuscitate order, and I created an I-post with a do not resuscitate order. And on Thursday, you say, well, yeah, I would want some interventions. Then you do a new one and you get another get the signature of the doctor again, and the most current dated one. Now, how does a medical professional know what the most current dated one is? All we can go by is what's presented to us. So if it's in your electronic medical record, we can see if there have been past ones, and we're going to look for the most current dated one. And I-post, which is a piece of paper that you're going to present, we have to trust that the paper that you're giving us is the most current one. There's no other way around that.
If there were two same date documents, DNR and partial, as a health provider, I would go with partial
Yeah.
because of the liability with that.
It could be
So that's always why
somebody's just doing a whole bunch of documents. So
Right.
they're doing them all.
Yeah.
They don't know what
Well-
one did before, so.
All right. We have a question here.
So if you take your medical power of attorney and your living will copies and you take them to records, say at McFarland, and they make a copy of them, put them in, do they automatically go to the hospital as well?
yes.
And that's because they're putting it into the electronic medical record.
Yes.
So it's not like they're going, hey, here, Mavis now has this and sends us. It just, if you were a patient at Mary Greeley, when we'd open up your electronic record, there it would be.
Yep. It's almost seamless.
I have
It's
a
great.
question.
It's nice.
I have a question on the DNR. Is one of the reasons they keep asking because it can be rescinded? If it can be rescinded, who rescinds it?
So that's a super question. So DNR, do not resuscitate. So I see patients in the hospital every single day. And sometimes I've seen these patients several different times over the years. Sometimes they're DNR, sometimes they're full code. They don't have, that's an order for when they're in the hospital. Yes. The way to have a DNR or a partial DNR outside of the hospital is to have an I-post.
It can be rescinded then.
It's not that it's rescinded, it's that it ends when they leave the hospital.
But what if they're in the
the-
hospital and their son is their medical power of attorney and they're a DNR and they tell their son, I no longer want to be a DNR. If they have the paperwork that says DNR, but then the patient tells the son, hey, you're my medical power, I no longer want to be DNR, or the patient themselves, they can change it.
You just rip it up.
You just rip it up.
Rip it up and throw it away.
Because my husband, I think, had a DNR, and well, actually, he had brain cancer, so he.
Hey, just 1 second. This is going to be long. And so instead of somebody having to repeat it, let's get it here on the microphone.
So when I was in the hospital with my husband, who had central nervous system lymphoma, and he was, he had to have brain surgery. And I think he, in his kind of frame of mind that he was in before that, had put DNR. And the surgeon said, I see you have a DNR And if you have a DNR, we cannot do this surgery. And I heard that several times. If you have a DNR, we can't do this procedure. So there is a way to rescind it. I mean, because then he would say, yes, I want the procedure, or.
I think they can be right there and be ready to let you go. And the family says, we've changed, if they're the medical power of attorney, right? They
Yes,
say,
that's
no,
true too.
we want
Yep.
you to resuscitate them. They resuscitate.
Yes.
Right, I think
The thing about surgery is they're going to code you in surgery, always. And
so.
yeah, and there's some other places in the medical community.
My question is, assume I have an I-post and I also have a medical power of attorney and my daughter is the medical power. And a situation comes up where the I-post designation is that I don't want some treatment. And my daughter says, wait a minute, he can't make decisions for himself. I want him to have that treatment. Does the doctor win or does the, I mean, who has the power here? Yeah, who has the power?
And I mean, that comes up for debate sometimes. It's not always.
Medical power of attorney only come into effect when you can't make decisions
Correct.
for yourself.
Correct. And if he's,
You,
the
well,
doctor determines whether or not a person can make decisions. If you're unresponsive, your medical power of attorney can go against everything that you told her you wanted. That's why in the beginning you try.
But he has.
Yes.
An I-post supersedes.
No, yes. Yes, we've had that in the hospital and it just comes up for debate and most of the time the physicians talk to your daughter and say, hey, this is what your dad wanted. We also have an ethics committee at the hospital that those kind of things have come to.
right, we do, yeah.
Yes. And, unfortunately, to come here and give a presentation like this, it would be much easier if it were all black and white.
Right.
Ugh. Yeah. Yeah.
That's hard.
So again, I mean, we just can't stress enough. And nobody has a crystal ball, but stress enough how important it is to choose or appoint somebody that's going to make the decisions that you want. That's got a cool, calm head when these big things come up and then they're, and that's hard. Mm-hmm.
I'm sure you ladies would have hundreds of stories to tell us that would help us understand why this is so important. And my husband and I have filled all these out. And when my friends ask us why, I remind them of the Terry Schiavo case in the early 2000s when her husband knew exactly what she would want, but she went into cardiac arrest and was in a vegetative state, but they hadn't written it down. And so the parents were able to override the husband, and this went on for 15 years and had 14 court cases. And if you don't want that, that's why this is important.
And the other thing I'll put out there is I know sometimes these conversations are not easy ones to have or to bring up. And years ago, on a similar topic, somebody said, if it's your children you need to talk to, and sometimes us kids don't always want to talk about that kind of stuff with our parents, to just say, hey, I went to a program this afternoon and this is what they told us. And I really think we should have this conversation and this is why. But this might be an easy segue for you to say, hey, guess where I went today? So.
If you have an I-post and you take it with you in your suitcase and you go somewhere and they need to use it and find out that you've never changed your doctor's name on it because he's no longer your doctor, what happens?
Yeah, that's a very good question. This is hard stuff. I mean,
And then he has one brown eye and one blue.
I don't know. That's a very good question. I don't know the answer to that. I guess
Follow it, it's got a doctor's signature on it.
if your doctor is,
To it.
I don't know the answer. I don't want to just say what I think because I don't know.
So one thing I want to say, so the doctor's signature, this is an order. This is an order just like your order for your thyroid pill. So your retired doctor is not going to keep signing your order for your thyroid pill. And also your Iowa doctor has no jurisdiction outside of Iowa with his license or her license. So that's the whole iPost thing. But that would fall under the same thing of make sure that you keep your documents updated. So if your doctor retires, get a young doctor so that they're gonna outlive you.
Is there a way we can access our records and see what they say now? I don't know what some of that record might be saying.
Well, you could contact medical records at either McFarland or Mary Greeley, and they could share with you what you have on file. Or your physician's office, when you're in for the doctor's appointment, they can look it up in your chart. Ask them to show you your most current advanced directive. And then confirm that it is the correct one.
I'm going back to her question. It's not like if you're an emergency and you're within the state of Iowa that they're going to take time to see, oh, is this her current physician or not, right? They're going to go with that iPost. I mean, that's like you said, that's the challenge.
You have an iPost.
Yeah, they'll be happy. Now, hopefully you haven't changed your mind too on what you want done, but you know, it's going to look like a legal, appropriate, and that's what you have on you. You're carrying it, right? So under hospice care, we see a lot of people in nursing homes, and every 3 months in a nursing home, you have a care conference. I'm not sure how it goes if you're in assisted living and that type of thing, but I know in the care centers, every 3 months they have a care conference, and I attend those if we have a hospice patient. They review their legal documents at every care conference. If they've got an advance directive, whatever family is in attendance or on the phone, they will say, the most current advance directive we have names so-and-so as the decision maker. We also have an iPost on file here, says DNR, says comfort measures only, says no artificial feedings. Is that still what you want? And then family has an opportunity to say yes or no. So those are reviewed regularly for people who are in a facility. One other thing that I would like to say about people who are in facilities, there is such thing as a do not hospitalize order. And I know this is good in the state of Iowa. I have no idea if all 50 states have such a thing or not. But people who do not wish to be hospitalized anymore, you don't have to go to the hospital. So if they think you have pneumonia and you don't want to be treated for the pneumonia, you don't have to be. And so if you say, gosh, I really don't want any excessive measures at all. I don't want to go to the hospital. I don't want on IV antibiotics. If you think I have pneumonia, I want you just to make sure that I'm comfortable. Call in hospice, whatever you need to do, but I want to make sure that I am comfortable. I hooked up with a good friend last summer down at Table Rock Lake, and I hadn't seen her in years. And her mom had been in a care center for 13 years down in Arkansas with memory loss. And she was telling me about how many times her mom had been hospitalized with pneumonia. And she was telling me that she just felt like her mom's quality of life was really, really poor. And I said, well, Kathy, does your mom have a do not hospitalize order? And she said, well, what's that? So half of our conversation that morning at the coffee shop was about a do not hospitalize order. Now, again, that's not for everybody, but that's what she really wanted for her mom. She did not want to extend her life in any way because she felt very strongly that her quality of life was so limited. And her mom just passed away in the last couple months. And she immediately shared with me, I'm so glad you told me about that because I had no idea that existed. And when she brought it up to the facility said, oh, I don't know if we have that or not for anybody. So then they did their research, and I thought, I cannot imagine a facility is not aware
that there is such a thing. But again, it's what your wishes are, and it's making sure people know and you express to others who care about you and who are caring for you what you want and what you don't want. A whole nother topic another day could be quality of life, because we all look at quality of life very differently. So we'll never agree on what that all means, which is fine. But most of the time, people take that into consideration with the decisions that they make. What is your quality of life?
And just so we know, somebody asked online, can we pick up these documents at the clinic or Mary Greeley? And I think you probably can. But also, LeighAnn and I just talked that I'll take the extra forms and maybe they'll get some to me. You can come to our office. You all have my email because you register and I send you an email to come here. You can email me and say, hey, can I stop by and pick those up, and we can have them ready for you. So if for some reason, that's probably more so to the people at home today, go ahead and email me what you would like and we'll make sure we get it to you.
Do these documents protect the legal aspect of the caretakers? Or, I mean, if somebody doesn't resuscitate somebody and then somebody's mad, do they sue you?
I don't know.
I would think there's been some family that have been upset about, I'm sure at somewhere in the history of hospitals,
But
something
whoever,
like this has happened.
the person who wants the document has created a legal document, and they have appointed daughter number 1, not daughter number 2 or 3 or 4. So they are giving that responsibility, that privilege to daughter number 1. And you don't have to agree to it. But it's a good idea to tell your daughter, number 1, hey, I want you to be my medical power of attorney, before you really put them down there. But once in a while, for what circumstances, you put somebody down there. So that's a legal document that says, this is my decision maker. So if you're making that decision, that's what you were given that privilege.
I was meaning the medical person, like the EMT or the ambulance driver or whatever.
Right. Would they come back and say, like one of two ways, either they had a DNR and a medical person went ahead and did CPR. Could the family come back? Or if let's say it's this way instead. The patient says that I don't want to, they have DNR paperwork. Staff don't do anything to save them. Can a family member come in and say, hey, I wanted them saved. You didn't save them.
Well, all of these documents that we have talked about today are legal documents that are either signed by a physician or signed by the individual. So I guess I can't say with certainty, but they're legal documents.
Right. As long as they have the paperwork to support what they did.
And the notary is indicating that the person for the document is of sound mind.
Oh, goodness. We should maybe take a break and come back for another couple hours. Who else has a question?
A really quick question. You talked about the minimum that a person would want is the advanced care directive that has a living will and the medical power of attorney. Is that a single document or those?
It can be. If you only want one, there is a legal form that has both.
And where can one get that legal form that has both?
We have them here. You can always, the Iowa Bar Association, if you Google the Iowa Bar Association, they're on their website too. So you can have a form that has a living will. You can have a form that has a medical power of attorney, and there is a document that has a living will and a medical power of attorney combo. So that takes care of each, if you want something different.
Okay, does it make sense? Because a couple years ago, we did my husband and I, to a trust, and I think that's included in part that we did that paperwork at that same time.
Yep.
Other people agree? Okay. Okay.
I think so.
1 second, I got the microphone back here, okay?
I guess I don't understand. If there's the electronic age, why does a person have to carry the form with them when.
Well, that's a good point. And once it gets in your electronic medical record, it's there. This designee for final disposition, for body disposition. I don't know that that form necessarily goes into your medical record. I don't know that anybody's going to stop you from putting it in there.
I think you're talking about the I-post, the piece of paper we keep talking about
You have to take.
that you have to take with
And
you.
a doctor has signed it.
And a doctor
So
signed,
why
yes.
would it be-
So I have a lady, several years back, did an I-post with her. She lived up north and went to the grocery store and collapsed in the grocery store, and she had the I-post in her purse. That's where that comes in.
Because then the ambulance came.
Because that little town is a volunteer fire department ambulance. They have no means of looking that up electronically.
So then, and that's what I was going to say. You talked
Mhm.
about some of these clinics that don't have, they just have paper copies. They don't have an electronic
Mhm.
or that
But-
situation where the paramedics are coming to get you.
Yeah.
They are required to provide to help you, correct? Unless
Yeah.
you have that sheet of paper with you.
And people have medical emergencies outside of medical facilities. They have them at the casino, at the grocery store. Uh-huh.
Yep.
Yep, at the
Yep.
ballpark.
Yep.
You know,
They do.
It would be interesting to know just maybe a percentage of what you think of people that do carry an I-post with them. Because I've never heard of that. I mean, I know it's a good thing, don't get me wrong, but
Right.
I don't think people are aware.
And we've done several different programs on iPost and talked, and I can't remember when it came out. We did a lot back then.
Yeah.
But my understanding too, and you guys help me, if you're in good health and you're whatever, probably a lot of people, it's usually if you have some type of chronic health type condition that you have special cares or needs that you want to make sure. I'm not saying it's not a good idea for anybody because I don't know. But that was kind of my recollection is, typically, you guys aren't going to carry an I-post, right?
And we can't, we don't qualify for one.
How do you qualify?
So to me, an I-post, so a chronic disease or a terminal disease. So if somebody decides they want to do an I-post, this would be a patient who, I as a healthcare provider wouldn't be surprised if they said, I want everything or I want nothing. You know people out there that they have stage 4 lung cancer spread to their bones, but they'll still tell you they want everything. And then you see the other guy who has stage 4 lung cancer, bone involvement, wants nothing. So it would be somebody who has a health condition that could go one way or another. I don't have that health condition right now. I don't think. So it's a chronic disease. I think about people who have really bad heart disease. Maybe they've been in and out of the hospital 7 times in the last year and a half. And they get to the point where there's still more that can be done, but they don't want to do anymore. So that's kind of a chronic disease as opposed to a terminal.
And that's probably why a lot of people haven't heard of it. Probably there aren't discussions from your physician or while you're in the hospital, they identify and would bring it up. If you're not as aware, it may not be something that maybe you've been suitable for you.
So here it says an I-post is appropriate for an individual who is frail, elderly, or who has a chronic, critical medical condition or terminal illness. So you have to fit in one of those categories to even create an I-post. And of course, that's going to be a conversation with your physician.
And sometimes physicians aren't always comfortable talking about these kind of things. Like you go to your dermatologist, that might not be the place you're going to hear it. Some physicians just aren't going to talk about this. So sometimes we just have to advocate for
I
ourselves.
say you have to be your own best advocate.
Absolutely.
sometimes.
Yep.
Yes.
And
yes.
all you can do is ask.
And push and then ask again.
Yeah.
Okay, I hate to confuse people, but I'm a 5-wish person. Okay, I went to a lawyer. I said, is this document legal? And he said, yes.
Yep.
But my question now after this program is, do I need a living will plus a 5-wish?
No.
Thank you. Also, I'd like to put a plug in to the 5 wishes.
Yeah.
If you have not discussed this with anyone, it's a great start. Read it over and fill it out. You don't have to sign it, but fill it out so that you understand what you've just written.
Yeah.
And the other person is going to say, are you sure? Because that's what happened to me. And I changed who I wanted.
You go, girl.
So thank
Right
you.
person. Yep. Yep.
Yeah, it is. It has more specific scenarios other than just DNR. There's a quality of
yeah.
life type aspect
Yeah.
to it, and
It's
yeah.
got a little touchy feely to it too. It's
Yeah.
really awesome. And I think it's a nice thing to have
Yeah.
after somebody dies because it's very special.
Yeah.
There's something special about it.
Okay, so you have copies. How are we going to get that to people? Because I'm sure there's going to be a lot of people here interested.
Oh, yeah. He says we need to charge for them. And if we don't have enough, I mean, I brought a pile, but if we
Okay.
don't have enough.
Let's do this. Let me close out the program. Okay. So we can close it out for people online and we answered that question online. And then if you're interested in some of the documents that we've spoken about, stay around and we'll get that figured out. Okay. So thank you very much. I know this is a tough subject. And if anything, this should show you all why you have to have these conversations so people know how you feel because they're not going to be put in a black and white situation when they're having to make a decision for you. They had to have had these conversations. So thank you so much. Just want to remind everybody to fill out your evaluation, give us topics for other programs or presenters, and you can put that in that basket on the table in the back of the room. And then our next program is Wednesday. I didn't, you know what I did? These two lovely ladies had presented for me last summer. And I used the same introduction today. And now I usually tell you about our upcoming programs, but you probably don't want to hear about the ones from last July and August after they spoke last time. So you will have to refer to our website for our upcoming programs that we have coming up. So anyways, thank you for joining us. Thank you for joining us online. I'm going to end the program, but we'll figure out for the documents here in just a minute.